The World Health Organization says an outbreak of Hantavirus on board a cruise ship is not the start of a pandemic. It adds that the risk to the wider public is low, but warns more cases could emerge as the virus can take up to 6 weeks to show symptoms.
So far, 5 cases have been confirmed out of 8 suspected infections. 3 people have died.
This is not the start of an epidemic. This is not the start of a pandemic, but it is a good opportunity to say that investment in pathogens like this are critical because therapeutics, diagnostics, vaccines save lives.
The WHO says the situation is not the same as 6 years ago with COVID-19 because hantavirus spreads through close, intimate contact. Hantavirus is usually spread by the inhalation of contaminated rodent droppings.
Health officials are now racing to map the outbreak and trace passengers who left a cruise ship before the outbreak was detected. And nearly 150 people were initially on board the ship. People from at least 12 countries disembarked in St. Helena in the South Atlantic Ocean on 24th of April. The first case on board was only confirmed on 2nd of May, weeks after the first passenger had already died on the 11th of April. The cruise began its journey from Argentina and is expected to arrive in Spain's Canary Islands on 10th of May. And those on board will be evacuated. Authorities across several countries are now monitoring those who left the ship as investigators work to determine the source of the outbreak.
Sanjaya Senanayake is Associate Professor and Infectious Diseases Specialist at the ANU Medical School, and he joins us this morning. Professor, good to see you. Let me start by asking you, about what the WHO has been saying. It's been stressing, that this is not the same as COVID-19 6 years ago. If you can help us understand and explain this as simply as you can, please, Professor, why isn't it the same?
Yes, so this is not a situation in which we need to panic. It's not 6 years ago where a new unknown virus spread widely throughout a cruise ship and then we saw it spread throughout the world. 2 important things about hantavirus. We've known about hantaviruses for decades, so it's not new. We know how it behaves. We know its natural history. And the other important thing, even with this particular strain of hantavirus, which can go from person to person spread is very limited. So it's not going to spread like wildfire. So there are 2 important reasons for which we shouldn't panic.
But is it also possible, Professor, that the virus could mutate to become more easily transmissible, human to human? I understand that the WHO has flagged hantaviruses as emerging priority pathogens. And we also know that the Andes strain has a, 40% fatality rate, which is way higher than COVID pre-vaccine.
Yes. Look, having said all that, it is an infection you don't want to get because you can become very sick with it. And you do raise an important point about mutations, and that's why we do an outbreak investigation, even if it's with a pathogen that we've been familiar with for decades, like we did with Nipah virus earlier in the year, because we just want to make sure that it hasn't changed. And the behavior by examining the virus in the lab and watching the epidemiology, how it spreads between people, will give us those answers very shortly.
Okay, but what would be the key warning signs, Professor, that this outbreak is becoming more serious? I mean, for example, if cases start rising quickly or we begin seeing clusters in multiple countries over the coming weeks, would that be enough to raise alarm?
Yeah, so if we're seeing person-to-person spread that is out of sync with previous outbreaks, where we've seen occasions in South America where there have been parties, where there's been very close contact of people for a sustained period of time, we've seen cases. But if we're seeing more fleeting contact and we're seeing case transmission, then that will give us an idea of what's happening. But as I said, that would also fit with the molecular aspect in the lab where we could look at mutations. But certainly at this stage, there's nothing to suggest that. But what is really unusual about this whole outbreak is we've never seen hantavirus on a cruise ship before. And unfortunately, it had to be that one strain, the Andes virus, which can be transmitted between people. Otherwise, normally it's not.
Professor, the US, the UK, and Singapore are among the countries doing contact tracing, but nationals from over 24 countries were on board. And we also know the incubation period is quite long, 6 weeks. So is this the possible weak link? Because, ultimately, contact tracing is down to how governments react, right?
No, exactly. And it is very important to identify all people at risk, inform them about when they might get sick. And one thing we have on our sides is that if people are likely to be infectious to other people, it's after they become sick. So if they're aware that they could get this infection, if they get sick, they can isolate themselves and contact health authorities in time. But you are right. A lot of the contact tracing and how efficiently this occurs will depend on the strength of the public health infrastructure of the various countries who are looking after those contacts.
Professor, there are still unanswered questions about how this outbreak even started. One theory links it back to Argentina before passengers boarded the ship. I mean, based on what we know so far, what do you think is the most likely source?
I think there's most likely been a mixture of transmission. As people now know, having heard about Hantavirus for the last few days, it's usually transmitted from rodents to humans through infected rodent secretions, which are aerosolized and inhaled. And if you look at the first case who unfortunately passed away, became sick on the 6th of April, which was only 5 days into the cruise, which is too short an incubation period for it to have been for him to have been infected on the cruise. So it suggests at least one person was infected on land before getting on the cruise. Now, subsequent cases, there may have been person-to-person transmission, but at least some of it happened on land before the cruise.
Okay, so authorities insist the broader public risk remains low, but should travelers be rethinking cruise holidays or even travel to remote rodent-prone areas for now? What's the rational response here? Is it more vigilance? Is it postponement or business as usual?
I think business as usual. As I said, this has been highlighted because it's something I've never seen before, a Hantavirus outbreak on a cruise. And so it's very unfortunate, particularly for the passengers and crew members of that cruise. But Hantaviruses have been around. Rodents have been carrying not just hantaviruses, but infections such as leptospirosis, which have been infecting us for a long time. And unless we've determined that this hantavirus has changed its behavior and mutated, I think we just proceed cautiously, but with life as usual.
So, Professor, I want to ask you a little bit about that caution as well. Is it true that the older you are, the more, I suppose, risk there is in terms of the disease or the virus being fatal for infected people?
So any virus that can cause an infection like this, which puts a strain on the lungs, is going to lead to a worse outcome in people who have got chronic diseases. And in particular, that suggests a lot of older people who are likely to have comorbid illnesses. So yes, it's something you'd rather get when you're young and healthy rather than when you're older. And unfortunately, with cruise trips, we do know that they cater to a lot of older people who've retired and want to enjoy life on the sea.
Understood. Professor, we do have to leave it there. Thank you so much for talking to us on Asia First this morning. Sanjaya Senanayake is Associate Professor and Infectious Diseases Specialist at the ANU Medical School.